Hi, my name is Edith Williams. I'm an associate professor of epidemiology with the Medical University of South Carolina in Charleston, South Carolina. I had my beginnings in Buffalo, New York. That's where I had all of my graduate training and where I participated in my first lupus study as a research assistant. This is when I learned the most about lupus. I was thrown into the Buffalo Lupus Project and asked to conduct lengthy residential, medical, and occupational history surveys with families in an area that was concerned about a toxic waste site and high rates of lupus and other autoimmune diseases. So I learned about these ladies' lives. I was introduced to and got to know their families, and they inspired me to continue work in the area of lupus and finding ways to make their lives better. Eventually, I graduated and moved to Columbia, South Carolina, and immediately I sought out opportunities to further conduct lupus research. That led me to collaborations at the Medical University of South Carolina. At that time, I was at the University of South Carolina, which is about an hour away from Charleston in Columbia, and I was able to go back and forth to work with lupus participants and patients in Charleston while still being housed in Columbia. Eventually, though, I received funding that enabled me to move to the Medical University of South Carolina to actually conduct my research there. So all of this added up to about 15 plus years of developing a research agenda around interventions to improve the quality of life of African American women with lupus. All of the research that I've developed and conducted has fallen under the umbrella of clinical trial research. So a clinical trial is a study that's evaluating the safety and effectiveness or a new drug or treatment strategy. Now, I'm not a medical doctor and I wasn't a pharmacologist, so I don't have a background in developing drugs, but I did know I wanted to do something to improve the lives of the types of ladies that I had gotten to know in my work and life in Buffalo, New York. So I figured that the next best opportunity was to figure out intervention strategies that would make the quality of their lives better. So that's what I decided to do. With clinical trials, they don't have to be drugs. It can be any type of strategy that you're trying to implement to see if it will change the course of whatever the condition is. So clinical trials are very important for developing new and safe and effective drugs and treatments by studying these things very carefully, but they can't be successful and we can't see the results that we need to see if we don't have the participants taking part in the clinical trials. Something that has been lacking in the field of clinical trials is the participation of minorities. So mainly people of color, mainly African Americans, and other minorities like Latinx communities, Native Americans. A lot of those communities are hesitant to take part in clinical trials because of a distrust that has grown against the academic community and the medical community. So this is a really important hurdle that we are having trouble addressing. So some of the challenges that we face in developing and conducting clinical trials, first of all, is eligibility. It can be really confusing for some people to know whether or not they should or would want to participate in a clinical trial because there can be very strict and sometimes complicated eligibility criteria. You have to have this, you have to be this age, you have to not have experienced this within a period of time. And all of this is to try to make the study of whatever that drug or treatment is as singular as possible, so you don't have a lot of noise or you don't have a lot of other factors that may be competing with the results that you could see between whatever that drug or treatment strategy is and whatever the outcome is that you're looking for. So that's why a lot of times you'll see these eligibility criteria that may limit who can participate, and sometimes people have a hard time navigating those complicated and complex types of criteria. Another challenge in clinical trials is the lack of information about them. I can't tell you how many people I've talked to who are like, well, I didn't know that I could be in a clinical trial, or I didn't know they had trials for this, or that there were trials in my area. So I think a better job needs to be done about spreading the word about what trials are available and who is eligible to participate in them. And then that word needs to get out to the people who would be eligible. So it doesn't help us if we have a list of clinical trials hanging up in the researcher's office where no one ever visits and the researcher never shares that information with anyone else. We really need feet on the ground sharing that information with communities who would be eligible and may be willing to participate in those trials to really improve the numbers of people that we have participating. But also we have the problem of just the resistance to participate. Like I was saying, in some of these communities of color, there's this distrust that has been built. I don't want to go to that doctor's office. I don't want to go and let them give me some weird drug and I'm going to be their guinea pig, or I don't trust that what they're saying is what is actually going to happen to me. So this is definitely one of the biggest challenges with participation in clinical trials. Now, some of the barriers, particularly to enlisting communities of color, because those challenges could happen with anybody. But some of the challenges that are specific to enlisting communities of color into clinical trials really has to do more with that lack of trust. But also, as I said before, the poor job of getting the word out. So what's going to be really important is that we have folks who are going to those communities that they may not normally interact with and letting them know about these opportunities in a very real way. And I'm going to explain what I mean by real way. But another consideration is considering the context of the folks that we're asking to be part of these clinical trials. We may have a clinical trial where it's very important for us to get the participation of young African American women, but how are they going to get there? This is a demographic that's caring for children and possibly caring for elderly family members and other relatives. Are we considering those other responsibilities that they have and making it as easy as possible for them to participate in these trials? Are we conducting the trials outside of their work hours so they don't have to take time off of work? Are we providing transportation? Are we providing childcare? Are we providing incentives that would make it worth their while and worth their energy and time that they're investing to really have them consider participating in a serious way? So a lot of those things researchers don't necessarily take the time to sit down and think about the communities that they're approaching and the other demands that they may have on their time and their energy. So those are things that we need to address as well. So I think some of the important steps to working together and addressing these really important issues and challenges to getting as much participation as we can in clinical trials from the minority community is first going to be transparency. We don't need to talk in circles. We don't need to use a lot of medical jargon. We don't need to make things sound a certain way and try to put it in terms that we think people will understand. People will understand if we just sit down and talk realistically to them. This is what we're doing. This is why we're doing it. This is why it's important. This is what's going to happen. These are the things that possibly could happen. Even being transparent about eligibility. We want as many people to participate, but if you don't have these things going on, if you're not engaging in these behaviors, we can't have you in the study. Not, oh, well, maybe we could make this work and then have people jump through a bunch of hoops when we know that they're not eligible or we may need them to participate in a different way. So I think it's a lot of not sugarcoating things, but really being straightforward about what we're asking people to do. And then better outreach about opportunities. We need to be in the communities and in the places where the people are that we want to recruit. If that means going to community events, going to health fairs, reaching out to community leaders and asking their opinion about where we should position ourselves or how we should be sharing information. We don't have all the answers. I'm talking like on the side of academia and research. We don't know everything. We don't know where everyone is. We don't know what they gravitate for as far as communication strategies. So we need to reach out and get help with that, and then use the advice that we're given and be in the places where we need to be to get the response that we're looking for. And then probably most importantly is making the case of how this is relevant to the folks that we're asking to participate. It doesn't matter that we think that this drug or this treatment strategy is the best thing in the world, it's going to change lives. If we don't make that relevant to that one person that we're asking to participate, how is this important to them? What does this mean to their life and their future or their family? Could you imagine a big problem in the minority community is transplants? Having people who are willing to donate their organs to others. So can you imagine the difference it would make having someone sit down with you who has been through an organ donation or had a family member who received an organ? How much more meaningful that would be to have a conversation with a real person who looks like you, has the same experiences, than just reading it in a brochure or on a flyer. So I think making these things meaningful and relevant to the communities that we're trying to recruit is going to be a huge piece. So I am currently conducting a clinical trial. It's a behavioral trial for African American women with lupus. It is called the Peer Approaches to Lupus Self-Management Study, or PALS for short. And what it is just putting African American women with lupus together. So it's a very simplistic model. It's about getting support and encouragement from other women who are going through the same thing, and then encouraging ladies to engage in activities to improve their disease self-management. So what we're expecting at the end of this trial is to see that women's disease activity improves, levels of things like depression and anxiety get better, and also their disease self-management as far as their willingness to engage with their providers, with their families, so really taking charge of their illness. And we expect to see better outcomes in a number of areas as a result of that. As part of this trial, there are two groups. One is a one-to-one mentoring group where ladies get together and a mentor delivers structured education. They do goal setting and general support over the phone every 2 weeks. And then on the other side, there are small groups of 4 to 5 ladies who get together on the same schedule, but it's in an unstructured way. So it's structured more like a support group. We collect outcomes throughout related to disease self-management, disease activity, and quality of life, and then we track their progress to see how those interactions with other women, other African American women with lupus, is impacting their disease experience and their disease outcomes. We've already seen dramatic decreases in depression and anxiety, women reporting that they feel more supported. So in essence, we are expanding the social support network of these ladies, even outside of just improving their disease endpoints. This is going to be a collective that they will be able to pull advice, encouragement, and support from for years after the study has ended, which is what we expect and what we hope for.